So we're privileged and honored to be able to be here at VIVA 2019 to take a first peek at the late-breaking session of what the Clout Registry looks like. So to have 50 patients in to date that we've looked at to show how they've done from an effectiveness standpoint has been wonderful. So what we can share with you now is that through our first 50 patients, we've seen more than 75% of our population have more than 75% of their clot resolved. We've seen significant improvements in the post-thrombotic syndrome rate, the post-thrombotic syndrome severity, the Volta scores, the VCSS scores, the pain scores, and the quality of life indicators. So by all measures, patients are doing superbly well. Specifically, when we look at the safety outcomes, we've done extraordinarily well. We've had no device-related major adverse events. We've unfortunately had one mortality in the trial that was unrelated to the DVT or the procedure done. We've had no major bleeding events. We've had one access site hematoma, but people are responding to therapy extraordinarily well. So Inari is a new dedicated venous company, dedicated to venous therapies across the spectrum. So the Clout Registry is a DVT specific trial, and Inari is very interested in a better understanding of new venous therapies. We have very limited data to date on what a modern thrombectomy device looks like, and the Clout Registry looks to answer that question. So the Clout Registry is a very unique new registry because it really mimics a clinical trial much more than a registry. It is a robust data collection on up to 500 patients, and we're looking at a series of primary and secondary endpoints that many registries just don't get involved in. The questions answered by the Clout Registry will help us design many trials into the future so we better understand deep venous thrombosis and the therapies to treat them. So part of what makes the Clout Registry unique is the way we've decided to look at patients. So we have a primary analytic arm, which is 91 patients looking at clot up to 6 weeks in one limb only. And that's slightly broader than many trials, but it really does look at what acute clot looks like. The secondary arm looks at clot from 6 weeks out to some indefinite period, and we know that thrombolytic therapy probably is ineffective past 6 weeks, and we've never tested the strength of a mechanical device on debulking clot in either the subacute phase or the chronic phase. So when we look at the distribution of clot in the acute clot, which is less than 2 weeks, the subacute clot 2 to 6 weeks, and the chronic clot more than 6 weeks out, it distributes across those three groups very, very well in the registry. And while we only have small numbers to date, we're very hopeful that by the time we get to our 500 patients in total enrollment, we'll have meaningful things to say on what thrombectomy looks like in all three spectrums of thrombosis. So the Clout Registry has a wonderful way of understanding how much clot we're going to remove. So rather than just having a investigator assessment of clot resolution or a duplex assessment that the clot's there or has resolved, we're using an independent core lab to look at martyr scores to determine how much clot truly has been resolved. And we're looking to see that we have more than 75% clot resolution within the registry. It's unusual for a registry to ask for data out to 2 years. It's unusual for a registry to really use an independent core lab rather than having just the investigators look at the venogram or look at a postoperative duplex. We're really trying to get a more robust data collection, a data set, to use this for the design of future trials, to really better understand what thrombectomy should look like and how patients do. So ClotTriever is a novel device because it really brings us a new type of technology to venous thromboembolic therapy. Rather than relying on thrombolytic therapy, which is what we've been doing for years, we truly have a mechanical device that is dedicated to the iliac and femoral venous system. So to have a new device that is dedicated towards thrombectomy is changing the landscape of how we can treat these patients. And in our trial, the majority of the patients were all candidates for thrombolytic therapy. But this is certainly a spectacular device for the patients that couldn't get thrombolytic therapy. So we're opening up new frontiers to who we can treat and newer devices to those that we currently treat.